Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. We're talking about lip fillers today, and really people who say, man, I got too much or I don't like the look anymore. What can you do about it?
Yeah, so when it comes to lip fillers, these are usually hyaluronic acids that can be dissolved with hyaluronidase, which is enzymatic dissolvement of the product. And if the lip fillers are something that they no longer want, then you can go in and you can actually dissolve that and give them back the lips that they once had before. Now, there are some patients who obviously over-augmented themselves, maybe stretched out the lips over years, and they might need a little surgical procedure to tighten up the skin that's been lax from the lip fillers.
And once in a while, you'll see someone with old silicone placed. So that can't be dissolved. We have to cut that out. So we do a fair amount of that. Yeah, and they look swollen, they look horrible, but in the advent of COVID, they can wear a mask and hide it for a while.
If they decide, I mean, is that one of the beauties of fillers, is it's not permanent?
Yes and no. I mean, one of the things is you can get a vascular occlusion with a filler, and the beauty of that is you can dissolve it and clear out the vessel. But if it is something they don't like the augmentation that they have, the beauty is you could just dissolve it for them.
And then some of the fillers are a no-go in the lip, like Radius, Bellafill. Those are big, thick fillers that are longer lasting, so you don't want to do that. So I agree with Chet. The hyaluronic acid fillers, you can dissolve them, be judicious, don't do too much. And for when people want a lot, I just have them come back a little bit more. Say, come back, maybe we'll talk about some more. But, you know, as we said earlier on the show, we need to learn to say no.
Right.
Well, I guess
cut off,
the uneducated question is, why wouldn't you want a filler that lasted longer?
It depends on the filler, and some of the newer fillers, the hyaluronic acid fillers, are longer lasting, like the Revance products, the RH ones do last a little bit longer. But generally in a soft area, you need a softer filler, and generally the softer fillers don't last as long as the bigger, harder, thicker fillers that you might use for cheek augmentation.
I got it.
Yeah, it's a mobile area. The lips are always moving, so products can get broken down quicker in the lips. So if it's one of those things where they don't like it and they live with it, it will eventually go away. So you don't actually have to enzymatically dissolve it if they don't.
If they do like it and they don't want to get it dissolved, typically how long will a filler last in a lip?
6 months.
Mm-hmm. Yeah. Sometimes 9 months if you're using different products, like the RHA collection you mentioned has a little longer lifespan.
I like those products.
Yeah.
The good news is you can do it and you can undo it. For more information, come to the place you can do it at theplasticsurgerychannel.com.